Hi, welcome back. We're on the next training module with regards to postpartum emotional and mental well-being. I'm Jay, and I'm here to help you understand what to expect emotionally in the postpartum period, the different mood disorders that can arise, and how they affect not just new parents, but also partners and other family members. The postpartum period is a time of great joy, but it also can bring some unexpected emotions, stress, and mental health challenges. Many parents are told to focus on their baby's well-being, but your well-being is just as important. So, what I want to discuss, the range of emotions that you may experience postpartum, the 4 common postpartum mood disorders, their signs and symptoms, how these conditions impact partners, spouses, and family members, and steps to seek support and healing. So, let's get started. So, the emotional roller coaster of postpartum. First, let's normalize something important. It is completely normal to experience a wide range of emotions after giving birth. Hormonal shifts, lack of sleep, physical recovery, and just the overall responsibility of caring for this new tiny life can all lead to mood swings, anxiety, and exhaustion. Most parents will experience baby blues, which are short-term mood fluctuations in the first 2 weeks after birth. You might feel teary, overwhelmed, irritable, or anxious, but these feelings typically pass on their own as your body adjusts. However, if your feelings persist beyond 2 weeks, or if they feel intense and unmanageable, it could be a sign of a postpartum mood disorder that needs attention immediately. So let's go over 4 of the most common postpartum mood disorders. So 1, you've heard it, postpartum depression. This is probably the most well-known mood disorder, and it affects about 1 in 7 mothers. And it can also affect partners and adoptive parents. Some of the signs and symptoms include persistent sadness, hopelessness, or feeling numb, loss of interest in things that you once enjoyed, withdrawing from family and friends, difficulty bonding with your baby, changes in appetite or sleep that are beyond normal newborn adjustments, feeling like you're failing as a parent. Without support, postpartum depression can last for months and impact your ability to care for yourself and your baby. Next, number 2, we're going to talk about postpartum anxiety. Postpartum anxiety often occurs alongside or separately from postpartum depression and is just as common. It is characterized by excessive worry and fear. Some signs and symptoms include constant worry, racing thoughts, or feeling on edge. Fear that something bad is going to happen to your baby. Physical symptoms like dizziness, nausea, or heart palpitations. You might have difficulty sleeping when your baby is sleeping, feeling unable to relax or actually enjoy motherhood. So while some anxiety is natural, postpartum anxiety becomes a problem when it starts to interfere with your ability to function or rest. Number 3, we're going to talk about postpartum obsessive compulsive disorder. This one is less talked about, but it still affects 1 to 3% of new parents. It involves intrusive thoughts and compulsions related to your baby's safety. Some of the signs and symptoms are unwanted distressing thoughts, like the fear of harming your baby or something terrible happening. Compulsive behaviors such as excessive checking to make sure they're breathing, excessive cleaning, or just different rituals. Avoidance of situations that trigger these thoughts and feeling really ashamed or afraid of these thoughts. It's important to note that these thoughts do not mean you will act on them. They are symptoms of anxiety, not intent. Number 4, this is probably the rarest but most severe postpartum mood disorder, and it affects about 1 in 1,000 births. It is a medical emergency and it requires immediate intervention. The signs and symptoms of postpartum psychosis include severe confusion or paranoia, hallucinations, so seeing or hearing things that aren't there, delusions or beliefs that aren't based in any reality, extreme mood swings, or manic behavior. Thoughts of harming yourself or your baby. If you or someone you know shows these signs, seek emergency help immediately. This is a condition that requires medical treatment. Postpartum mood disorders don't just affect the birthing parent, they can impact partners, spouses, and even extended family. Partners can experience postpartum depression too. About 10% actually of new fathers struggle with postpartum depression, but their symptoms probably look different. Like they're probably more irritable, withdrawn, or they work for long hours so they avoid coming back home. Family members might feel hopeless or unsure of how they can provide support. They might misinterpret symptoms as a parent being ungrateful or not trying hard enough. Strained relationships can occur in a parent, or can occur if a parent is struggling with their mental health, doesn't feel understood or supported. And that's why open conversations, education, and support systems are key in the postpartum period. So, seeking support and healing. If you or somebody that you love is struggling with postpartum mental health, please know you are not alone and help is definitely available. Here's some steps that you can take. One, talk to your provider. Whether, it's an OB, a midwife, a primary care doctor, let them know what you're experiencing. Two, reach out to a therapist. A postpartum mental health specialist can provide guidance and support that is specific to postpartum. Number three, lean on your support system, whether it's your partner, your family, members of your community, members of your church, or a trusted friend. Tell them how you're feeling. Four, you need to prioritize rest and self-care. Small steps, small bites of self-care and rest are really important. Go for a quick walk, journal. All these things can help you ease any kind of stress. And then there's no shame in using medication. So number five, depending on your conversation with your doctor, that can be a part of your healing journey if it is recommended by a professional. And it's nothing to be ashamed of. Postpartum mental health challenges are not a sign of weakness. They are not a sign of failure, but they are real and they are treatable conditions that many new parents will face. I hope this module has helped you understand postpartum emotional well-being and the importance of recognizing the signs of mood disorders early. You deserve support, care, and compassion during this time. If you ever felt overwhelmed, please reach out, whether to a healthcare provider, a loved one, or even to me. You are never alone on this journey. Thank you for watching, and I'll see you in the next module. Bye.